Thank you. Thank you so much for having us here today. And welcome, everybody. It's great to hear people from so many different places. My name is Abbie Newman. I'm the CEO of Mission Kids Child Advocacy Center in Montgomery County, Pennsylvania. Just by way of background, Paula gave a little bit of it. My initial training was as a registered nurse, and I practiced pediatrics at Mount Sinai Medical Center in New York City for several years before I went to law school. After law school, I practiced law for a number of years, and I represented doctors in hospitals and medical malpractice cases doing defense work. In 2008, I was asked to join the people that were founding the Mission Kids Child Advocacy Center in Montgomery County, Pennsylvania, and I became the founding executive director. And I was in that position until a few years ago when we were lucky enough to have Leslie Slingsby join us at the center, at which point I became CEO and Leslie stepped into the executive director role. And in my CEO role now, I'm responsible for macro level leadership in the area of child advocacy work and responses to allegations of child abuse outside of Montgomery County. And Leslie is responsible for day-to-day operations in Montgomery County. Leslie, do you want to say a little bit about yourself?
Sure. I'm a licensed social worker in the state of Pennsylvania and have a background in nonprofit management and social and public policy. I worked for over a decade in victim services before starting a neighboring child advocacy center and some work in quality assurance in public child welfare. And my current role at Mission Kids is overseeing the operations within the county and the services to children.
By way of context and for background, for those people that are joining us from Israel today, our friends, the map in the top right corner is a map of the United States, and that red rectangle is the state of Pennsylvania where we're located. The map on the left side of the screen, the larger map, that's the state of Pennsylvania up close. Montgomery County is that red rectangle in the state of Pennsylvania, which is where we're located. We are a bedroom community to Philadelphia, the city. We're right outside of it. We're about 2 hours by drive on a normal day south of New York City, and a 2.5 to 3 hour drive. You keep going further south, we're north of the city of Washington, D.C. We are a very diverse county, both socially and economically. We have some of the wealthiest zip codes in the United States, as well as pockets of poverty. We have many different ethnicities that reside in our county. We're relatively large. We have over 800,000 citizens. And we just put the numbers up on the right side as well, just so again, you have it for sake of comparison and context with wherever you're coming from today. We were asked to speak today and present our experiences in a county that was later on, a couple of weeks ago now, named the epicenter of coronavirus in Pennsylvania. We always like being first in Montgomery County. Frankly, that wasn't a distinction I ever really wanted to have, but nonetheless, we were first again. And so we're going to discuss what happened in our responses from both the high level public policy and macro level, and then how those interacted and worked on the ground with the day-to-day implementation of our program, the changes that we've gone through, and how we're still changing to adopt to COVID as it still keeps working. Although we're going to be talking from the CAC or Child Advocacy Center experience, a lot of what we're doing, I believe, is easily transferred to all of our partners, which would be schools, police, social workers, but also teachers and schools, and really most other organizations that work with children or with people. To make sure that everybody's on the same page of what a child advocacy center is and does. Child advocacy centers facilitate responses to allegations of child sexual abuse, and for Mission Kids, in addition, we also see children with allegations of serious physical abuse or who were witnesses to violent crimes. When a case of child abuse is called in and it goes to either a police department or the Office of Children and Youth, which is our county DHS agency, those agencies will start conducting their own investigations. And when they feel the need to interview the child, that's when they call Mission Kids. We will set up an interview at a convenient and reasonable time for both the child and the family, as well as our partner agencies to all come to Mission Kids. Our team members will meet in a team room and discuss the case and the allegations from all of their perspectives before the interview takes place. And the middle photo on the screen is that team room. They then watch the interview on closed circuit television, and you can see that up on the wall from an adjoining room. The forensic interviewer is specially trained to ask neutral, age-appropriate, and non-leading questions. They meet one-on-one with the child, either depending on the age of the child. in the younger child interview room on the left side of the screen or in the older child interview room on the right side of the screen. The team watches the interview live. They get to see the nuances of a live interview, and the child doesn't feel like they're being cross-examined at all. And the interviewer will take a break before she finishes and make sure that she's covered all the questions that everybody needs. The interview is recorded, and this way everybody has it for later on, and the child, in most cases, does not need to be interviewed again. Since we've been open and started seeing children in 2009, we've seen about 5,000 cases. We see, absent COVID, about 600 children per year. We work very closely with our district attorney's office and the Office of Children and Youth, and what makes us a little different is that we have 50 police departments that we work with as well. We've been nationally accredited since 2012, and our organizational structure is that of a freestanding nonprofit. We are not an arm of either the DA's office or a government agency, nor are we part of a hospital system. We are a freestanding nonprofit. We have about 18 full-time employees, 3 part-time, and 2 independent contractor mental health providers that work with us on staff as well. Now, the timeline of events, we all started hearing about COVID just like everybody else did in the news and, waiting what's going to happen. What is this virus going to be? We really first started hearing about it on March 7th, March 5th, March 7th, in that time. And on March 7th is when it became known that the first 2 cases were in Montgomery County. There were 4 cases in the state at that point. We had 2 of them here. And what definitely impacted Mission Kids is that one of those cases was a physician with the Children's Hospital of Philadelphia. That's our partner medical agency, who we refer our children to for medical examinations. Although they're located in Philadelphia proper, they also have a large medical office building in our county where they see our kids. And one of the first 2 reported cases in Montgomery County was unfortunately of a physician at CHOP in that medical building. And some of our clients, as well as some of our staff and partners, had been in that office building prior to it being known that he was positive with COVID. The county the next day immediately declared an emergency declaration because they realized how many people had been potentially exposed in this medical office building. And that was to provide increased support to agencies and municipalities responding to the virus. I have to give a shout out to our chair of the county commissioners. They're kind of like the mayors of the county. And our chair is an anesthesiologist. How lucky are we in this particular time? So she's been leading our response, and so we've really been on top of it in a big way from the beginning. She made sure that everybody was notified, not of names, but to make sure if they had been potentially infected. The next day was Monday, March 9th. We came back to the office and immediately started implementing policies, which are now very commonplace. But at the time, we were getting some questions like, oh, what's going on? Why are you so worried about COVID? We started social distancing. At the time, we thought it would be 4 to 7 feet because we weren't really sure what the times were. We said no more handshaking. We said don't eat lunch together in that team room all the time. Make sure that there's a seat in between everybody. Wash your hands frequently. Wipe down your workstations with disinfectant wipes. We don't know what this is. And this was really confusing because at the same time, there's a lot of contradictory information coming in. That same day, the president was tweeting and commenting that it was just a virus and it was no big deal. There's nothing to worry about. So we start implementing everything. Stay home if you're sick. And obviously at this point, we know the cat's already out of the bag, but at the time we did not know that. Within 2 days, everybody will remember the president's address to the country that evening. Flights were now canceled from Europe, incoming within 48 hours. A national emergency is being declared, and suddenly we're off to the races. The next day on March 12th, one of our detectives that is on site with us all the time, somebody very close to us, was diagnosed positive with COVID. Luckily, that individual is fine, but at the time we were all very, very concerned. That person and the person's spouse were both declared positive. The governor on that day declared our county to be the epicenter of COVID, and out of the 22 cases that were now in the state, 13 of them were in our county. How lucky could we get? So yeah, so that's where we were. All entertainment venues and non-essential services were closed at that point, as were schools. And this was pretty early on for this to be starting. The very next day, March 13th, which is a Friday now, our staff began working remotely from home and only coming on site if necessary for interviews. And just now, in the context of what we experienced, Monday, March 9th, we started implementing social distancing, hand washing, and those precautions by Friday, we were all working at home. That's really fast. That same day that we started working at home, the president declared coronavirus a national emergency and asked hospitals to activate their emergency preparedness plans. That was important for us because that was how we were judging what we should do and how we should do it and how we should be able to keep our operations going. The following Monday, March 16th, things had been changing so quickly. We'd been implementing these policies, but in staying on top of everything, it wasn't until the following Monday we were finally able to reduce everything to writing, although we've been keeping in close contact with our staff. Our county had snowballed up to 30 cases now positive in the county. On March 18th, community testing was opened in the county. We're up to 42 cases. What's not on the timeline is that on March 20th, we had our first chapter call of CAC directors from across the state. There are 40 CACs in Pennsylvania. Most of the directors were on this phone call. Some of those discussions are, when we have those chapter calls, they're kind of businesslike, sometimes a little boring. You get your information, you move on. This sticks in my mind because of the intense discussion that happened between all of the directors from the different centers. How are we going to operate? There were many centers that had not seen any cases yet in their county that were saying, we're not closing. What's going on? Why are you staying home? But no, we're emergency services. We need to be open. And the discussion, which we're going to go into more in detail about what happened and how we developed. On March 23rd, Governor Wolf issued formal stay-at-home orders for 7 counties, including ours. It didn't matter to us. We'd already been at home for 10 days at that point. It was just including more counties at this point. Several in our area, also as well as Pittsburgh out on the other side of the state. We're up to 136 cases. And as of this past Friday, I wanted to just show you that snowballing doesn't describe it. We're now up to, certainly over since Friday, 2,500 cases in our county alone. And I would wager that over the weekend, we must have topped the 30,000 number for the state of Pennsylvania. And so here we are. There is a statewide stay-at-home order that has been in place in Pennsylvania since April 1st. Everybody's at home. Schools are all closed. This graph is showing the number of cases, positive cases in Montgomery County, just from a different view as to how they increased. As you can see, on March 18th, things were still kind of low. That's when more community testing was offered, and that's when we suddenly see the spike in more positive cases as we moved on. In looking at this, we might be able to say at this point, this goes up through last Friday, that maybe we have plateaued and maybe this is our curve that we've reached. But I had somebody who's working in response from one of the hospitals in Philadelphia tell me that maybe yes, and maybe what this is actually showing is indeed that we're getting ready for a second surge. So that's kind of scary. We don't know. We're obviously not going to know. We're going to see what happens with time. As I said, schools across the state are now closed. They have been closed through the end of the school year. We know that the courts in Montgomery County are now closed until the end of May. So I don't know what's reopening in the country or any place else, but I think we're kind of in it for the duration over here. These maps show the spread across the state only within a month's time. As you can see on March 22nd on the left, the darker counties are those that have more COVID cases. Montgomery County has the dubious distinction of being the black rectangle down there. Those cases, the counties rather, with the lighter colors have very, very few cases. You can see now over on the right how that map has drastically changed in less than a month's time. The only counties that have very few cases are those light green ones, kind of like northwestern part. Now, that's a very rural section of the state, but the majority of the state in between Philadelphia and Pittsburgh is rural, for those of you that are not familiar with the state. So again, for context, we not only have a lot of COVID in heavily populated counties like Montgomery, and certainly Philadelphia has many thousands of cases at this point. I forget how many right now, but also in the rural sections as well. So the dilemmas that we've faced and what do we do? The first question is, what is an essential service? And how do we decide that? We're in the business of helping at-risk kids. We're in the business of helping suspected victims of child abuse. So aren't all of our services essential? And that's a really good question. So we did a risk-benefit analysis early on as to how are we going to handle these cases. We all know at this point that somebody over the age of 60 or 65 without any other underlying illnesses is going to be a high risk. And that's a hard objective fact, whether or not somebody on your staff or a team member is of that age. We had some discussions with staff. Well, we know who on staff, we have a fairly small staff for us, who's going to have underlying medical issues, diabetes, heart disease. We know each other really well. Well, I'm going to say maybe we do and maybe we don't. People have a right to not share every detail of their medical condition with their friends on staff. And even if we may know of somebody that has a serious medical condition, we now know that things like high blood pressure and asthma also make somebody more at risk for a bad response to COVID if they contract it. And are we going to know that about somebody? We also know that obesity can be a risk factor in and of itself. And how do you say that to somebody on staff? Well, you're at higher risk. That can become an issue and problematic. And then beyond that, how do you live? What happens if they live with somebody in a high risk group? And is that something that we're going to know as we decide who's going to be working and continue working? There's also somewhat of a new dilemma, which I think we're first beginning to look at and think about, is what is an essential case today for somebody to come into and what's maybe non-essential and we feel that we could put off a little while. As more time goes on and as everybody is in self-quarantine, are some of those non-essential cases suddenly going to become more essential? And how do we decide that? And when do we decide that? And I think that's a whole new world that we're just beginning to enter. And then there's another issue, which is how do you make sure that you don't transfer COVID to the non-offending caregiver? We all know at this point that people can be asymptomatic carriers. Anywhere between 25 and up to 50% of people who have COVID are going to be asymptomatic. That's great if you're one of those people and that's how you get COVID. But what if you then give that to the non-offending caregiver and you don't know that you're giving it? This non-offending caregiver may be the primary support in this child's life. What happens if we give COVID to that non-offending caregiver, and even if they're not in a high-risk group, they end up hospitalized or ventilated and away from that child for weeks or a month of time? What happens to that child? What happens if that person dies from COVID that they've contracted bringing their child to the CAC? We want to help that child. That's why we're there. That's why our team members are there. But are we truly helping that child if we inadvertently end up passing on a disease to their non-offending support, their most supportive person, and kill them? And that's really not an exaggeration, unfortunately, in this day and age. So we had to then consider, what is an emergency? What are we really going to be bringing people in for? And so what we decided on site for us, that an emergency was going to be a case where there was an immediate safety threat to that child. The alleged offender is a household member or a caregiver or has access to that child, and a safety plan could not be put into place. Or cases where it would be detrimental to the investigation if the interview did not occur immediately. Or, because we always need this, other cases at the discretion of the executive director, because you know there's always going to be cases that come up that you could not have thought about. And so with that, I think it's a good point to segue to Leslie. Leslie?
Great. Yeah, so what we did was we put into place on March 16th, kind of a screening tool. We wanted to make sure that we were screening families as well as any team members that were coming on site. Now, while these questions don't all make sense now, at the time they did. So our first question was, have you, your child, or anyone in your household traveled internationally within 14 days? Now you have to remember that was the question at the time to see if by any chance they were bringing it in from another country. And so we would call family members from the phone before they would come in and ask these questions. And if that question was yes, then they would have to bring it to kind of management team and us discuss, weigh the risks and benefits. We also were asking, have you, your child, or anyone in your household come in contact with someone who is a laboratory confirmed test of COVID-19 within the last 14 days? If yes, we would not have brought that in and we would not have scheduled that case, but we would also be discussing kind of what is a safety plan and plan for that child. do you, your child, or anyone in your household have a fever of over 100.4? And we realize that kids get fevers all the time, right? But we did actually use this as a risk factor, and we wanted to kind of discuss it with the team anytime we would have this arrive. So we also asked our team members this and our staff this before they would come on site for an emergency interview. Now, this is different than the questions we're asking today, but these are the questions that we started asking on the 16th.
Okay, I'm sorry. All right, sorry, couldn't see my slide there. So here's another dilemma. What happens, we are offering this interview, a child has been potentially sexually abused, seriously physically abused. Leslie, the staff do the screening questions.
Yep.
And somebody says, no, I haven't been traveling. No, I'm not infected. No, I don't have a fever. I've not been exposed to anybody, because they want to help their child. That's what they want to do. And so they lie. I can see that easily happening. And so to protect their child, they come onto site not thinking that they're going to harm anybody else, but just wanting to get help for their child. And I've heard that happening nationally at other CACs who've been doing the same type of screening. Leslie, have we experienced this at Mission Kids?
So it's hard to say whether we think anyone was dishonest with us regarding if they had any symptoms or had contact with anyone with COVID. Now, what we do know is that we did have a family member who came in with a child and 3 days later was a confirmed case of COVID. And so the law enforcement officer did let us know that that was the case, and we quarantined those staff for 2 weeks. Those staff, it's been over 2 weeks, they were fine. So we're not sure if they knew or they didn't know, but we assume that they didn't know and this could happen to anybody, and that we just quarantined those staff members.
Okay. Which even if it's done inadvertently, again, if somebody could be infected, it's a problem. Everybody's got to be quarantined.
Absolutely.
Leslie, you want to talk about the extra precautions now that we're doing?
Yeah, so we put some extra precautions in place. We limited the number of CAC staff on site. So at first, we allowed one forensic interviewer, one family advocate, and one case coordinator. And you can kind of see there's like a fishbowl-like area. We call it the fishbowl, but that's because there's 3 windows on each side. And so that's where a case coordinator would be, who would be watching the family. We also limited the number of MDT staff on site. Because of technology, we don't actually need to have so many people observing the interview. And so what we did was we had a law enforcement officer come on site, and then we had a prosecutor and a child protective service worker kind of touch base remotely and watch the interview remotely, so that we would have one team member in for security reasons, but also to provide feedback to that forensic interviewer. We also allowed only one non-offending family member, which I know is really hard for families, but in these times, we really needed to say we need one healthy, safe adult with that child. We also made sure that we wiped down all surfaces between clients with disinfectant. And so we were very careful about not only anything that our clients touched, it was anything our staff members touched, our MDT members touched. We also had a cleaning company come in every day, even when we were not there doing emergency interviews, so that we could make sure that it was disinfected every evening. There was also a pretty quick shortage of hand sanitizer. And still is a shortage of hand sanitizer, and that's where we have so many wonderful people out in the community kind of finding us hand sanitizer, delivering us hand sanitizer, making hand sanitizer for us. But that was certainly a problem and continues to be somewhat of a problem still.
Leslie, I know that many families often come with more than one child, and as people can see, our interview room our waiting area rather is set up for multiple families. Have there been limits on the number of children? Can families bring other siblings with them? And the limit on the number of families at a time?
Yeah, that's a good question. So we have limited it to one family member. We did say a non-offending family member, 1 adult, but we have limited it to 1 adult. And if we have not actually had an emergency interview yet with multiple kids in one family, so we actually haven't gotten to that answer yet, we may, I'd have to do the pros and cons. We have to sit down on our team. We might allow 2 kids in that scenario.
Makes sense. And the new orders?
Yeah, so we had last week new orders that took into effect last night. New orders by the governor that said that all workers now required of essential businesses, which we are considered a essential business in the state of Pennsylvania, are required to wear masks except for taking breaks to eat. And they can be masks that people made from home but need to have a mask. We have in the past, we're not a medical base. We did not have masks. The other rule is workers must be able to take breaks at least 6 feet apart. When there has been exposure at the business, the area visited by the infected person must be closed off and ventilated. After a minimum of 24 hours, the area as well as the common rooms shared and all electronics must be cleaned and disinfected. Business must identify and notify employees who are within 6 feet for about 10 minutes or longer with an infected person. And if an employee tests positive for COVID, they must have a temperature check returning to work. So these are brand new kind of things that we're trying to deal with. We are so lucky that we have a pharmacy locally who said, we believe in your mission. What do you need? We said we need masks, we need gloves. And so what we're doing is putting into place that everyone, of course, would wear a mask during this time. We would also have masks and gloves available for our clients who walk in the door. And unfortunately, this is kind of an expectation and a realistic situation currently. So we think that people will understand and be used to it since walking around, they'll see that. But that's our plan for right now.
I, of course, am the one that raises all the dilemmas that now go along with the governor's order of wearing masks and gloves and all the other medical dilemmas. So this was a question as we've been working through this now for over a month. Should we be wearing masks? Should we be wearing gloves? And now it's not optional at this point. As of 8 p.m. last night, if we're open, if we have a child come in, masks are on, and that's just it. That's great. And there is a use, it's been shown that wearing a mask will help prevent the spread. And to make sure everybody is aware, wearing a mask doesn't prevent you, does not prevent the wearer of the mask from breathing in the virus from somebody else. However, it is supposed to prevent you, if you're an asymptomatic carrier, from passing that virus or lessening the chance that you're going to transfer that virus to somebody else. So this will help to take care of the situation of our passing it on to, say, the non-offending caregiver. It will help eliminate that. But only if the mask is used correctly and the gloves are used correctly. And nobody says anything about that. And I actually wrote an email last week to our Department of Public Health saying, you can't do this. I'm trained as a nurse. We spent hours learning appropriate infection control with masks and gloves for people in the hospital who had infectious diseases. If you let's just even take the gloves out of it, all right? You're not wearing gloves, you're being careful, but you're touching things and you know that when you're done, you're gonna wash your hands. Or you're wearing gloves and you're not worried because you're touching things and your hands are protected. You're not worried about touching things on surfaces. You see the child, you finish the interview, you're ready to now take it off and go home. If you put your dirty gloved hand or your hand that you haven't washed up to your face to take off your mask, you're infecting your face and you're touching your face. And you're getting rid of any protection that you could have given yourself. If while the mask is on, I don't know how many of you have used masks at this point, your face gets kind of hot and a little itchy underneath the mask. If you go and push the mask down or readjust it, the way that the virus is transferred is by breathing it in, touching your face. It can not only go in through your nose and mouth into your respiratory system, it can also go in through your eyes. How many times a day do we touch and rub our eyes that we don't think about? And I personally think that when people are wearing gloves, they have this false sense of security and they forget that their gloves are dirty and they can't touch themselves with it. So the proper way to do it is if you're taking off your gloves, again, do people know that to take gloves off properly, you just can't rip them off. They have to be turned inside out and then dropped. The outside is dirty, then the outside part goes to the inside part goes to the outside. So then that surface is clean and you drop it into a trash can. If you don't do that, you have the dirty part of the glove just laying around. And there have been reports in Pennsylvania of supermarkets where people are wearing gloves into the supermarket. They come out and they just throw those gloves on the ground. That virus can well be transmitted in that regard. If somebody steps on a dirty glove, the virus can actually transfer to your foot and then you bring it into your home. So you're just increasing the risk that it's going to be passed. How do you take a mask off? All right, you take your gloves off inside out. You wash your hands. Now your hands are clean. You can take your mask off and not infect yourself. What are you doing with the mask? If it's a reusable mask that somebody's made and they're taking home, have they dropped it on a surface where they are? Are they dropping it on a table? If they've dropped it on a table, the mask is infecting the table and the surface needs to be wiped down again. Are they taking it and just, is it something that they're throwing out? It's a disposable one. Are they putting it into a trash can with a lid that swings back and forth? If so, you're touching that lid, you're infecting the lid. Okay, there's no lid or you're using a foot pedal, so you take care of that. The mask goes into the trash can. Who's getting rid of the infected stuff that's in the trash can? I'm sure everybody's been to medical offices where you see red waste bags in certain trash cans. That's to alert anybody coming in or cleaning staff or janitorial staff that there could be infected stuff in there. Don't just pick it up and not worry about it. Well, we don't have that at CACs. So we have to figure out a way to make sure that if we're leaving it for our janitorial staff, that they know not to, to try not to get infected somehow with the waste that we're leaving, or if we take it out, to make sure that we're being careful that we're not reinfecting ourselves. And that's the part that nobody talks about with using this personal protective device. Forehead temps. I've heard of other CACs, and we now have this order in place where temperatures have to be checked when somebody comes back to work. All right, think about social distancing. Somebody said, all right, well, we do forehead temps. We don't have to touch the mouth or saliva. You put your arm out. Your arm is not 6 feet long. So if you're doing a forehead temp on somebody, what are you, at most 3 feet? That's a pretty long arm. And then, I'm sorry, everybody, you're up close and personal in the person's face. And if this person is a carrier, hello, thanks, I wanted COVID, thanks very much. And this is what we're trying to do good. This isn't good. So how do you check the temperature? And somebody else said, well, you just have the person check it on the way in. They can do their own forehead temperature. Okay, they do the forehead temperature. They don't have a temperature, that's great. We don't know, but they're asymptomatic, okay? What do they do with the thermometer? If they put it down on the table, are we being really careful about wiping that table and picking up the thermometer and wiping it down or whatever we're doing with it? So again, there's a lot that goes into place with saying, well, we're just gonna be using personal protective gear. And everybody wherever you're working, you really need to be thinking about this and get appropriate instructions for how to do it. And then this, of course, begs the public policy issues that may be lessening at this point as people are making homemade masks, but I know that we're having difficulty finding masks from, say, a pharmacy, is people we know in emergency rooms, on the front lines, our medical providers are still having problems and shortages of personal protective gear. Which is the bigger priority? Seeing our child who might be a sexual abuse victim, or seeing this person who is sick with COVID, who could be one of our friends or relatives? There is no easy answer to that. That is a really, really difficult question, which is why when we see cases wherever we're seeing them, we just have to be very cognizant of the risk-benefit analysis that we're doing pretty much from every step of the way. All right, I think that's all that I have to say. You never thought you'd hear so much about masks and gloves, did you? But that's my particular, one of my soapboxes.
Well, you are right that we had to ask some of those really difficult questions and make some decisions. First of all, obviously, what we are currently doing is all staff are working remotely. We are so lucky that we had most of the technology to be able to say, everybody, pack up your stuff for the next 2 months and head home today. And so luckily we had a lot of technology where most people were able to do that. We said emergency forensic interviewing only. And you're right, we had to make some tough decisions about what does emergency mean? And we were very conservative what really needed a forensic interview. As some of you who are making these child welfare issues, you have some team members who everything's an emergency. And so kind of explaining to them that it's not was really challenging. When we said a child was having contact with an offender and no safety plan could be put in place, that actually narrowed it quite significantly, right? And so most of these cases we actually could, with our police and our child welfare professionals, they were able to put in a lot of safety plans. The other portion was a little bit more challenging. The portion of would evidence be lost if a child didn't come in for a forensic interview? For example, we thought there would be extreme coaching, right? Another one could be, do we think actually physical evidence would be lost? And the third was, would the child's statement still be the same? So for example, we had a 5-year-old and this was getting pretty long. How long do we think that 5-year-old was going to be able to tell us that story? How long was this child's memory going to be last and be accurate? And so we kind of made a decision that, yes, we think this 5-year-old should be coming in for a forensic interview. And this is us consulting research, right, on children and their memory and memory loss. And so we made a decision, yes, we're going to have that child come in. Now we put in all the precautions by asking about everyone's safety and, everyone's health and wellness, as well as their family's health and wellness, and made some decisions about that. Another one that we struggled with is we had a homicide, and we really thought the public safety could be at risk if we weren't able to get enough evidence to be able to file charges and put this alleged murderer behind bars. And so we had conversations, and we actually spent about 3 days trying to get additional information, so we did not have to have this child come in and tell their statement. But I think eventually decided, yes, we probably did need that and bring them in. And so we were making these decisions to be able to do the best emergency interviews and make the best decisions for that child, as well as, I guess, the welfare of the community. We still are paying all of our staff their full salaries. We had a few options. We're very lucky that our the Pennsylvania Commission on Crime and Delinquency said that you can put staff on administrative leave, meaning we realize they will not be doing accompaniment. We realize that they won't be doing forensic interviews, but you will still be able to use these government funds to pay them. And we're saying okay to that. We decided not to do that, even though we put a policy in place for administrative leave. We decided that we would rather have them work from home and be a little creative about. All of us have had lists and things that we've wanted to do for a long time that kind of get backburnered with emergency, that maybe we could be creative and try to think outside the box during this time. And we were able to really do that. Now, some of the problems with that is we have some single parents who are being the, cook, the chef, the, maid at home, also the teacher right now, and working. So we realize that they have a lot on their plate, and we kind of made a conscientious effort to say how we're going to avoid burnout was through compassion and through understanding and through working with them. And what we've seen in return is people who are so committed to Mission Kids and so grateful to the organization that has helped them through this stressful time. So yes, that's what we've done so far. Now, we have had some issues regarding what if one of our staff is a healthy person and has been doing this self-isolation and quarantine and doesn't feel comfortable coming into the office for emergency cases. We actually had that with one. We have a pregnant staff member. She is 8 months pregnant, and she actually said, I want to come in the office. And I think the rest of us had some really ethical or moral dilemmas about that. And what do we do? And what does discrimination mean and in this situation? And so we had to really do some soul searching regarding that. And then we have some other staff who said, I understand we're doing emergency interviews, but I do not feel comfortable. I have been protecting my family by staying at home. I've been at home for a month now, protecting my family. Coming into the office, I'm really nervous. And so luckily we've had a mix of people, some people who want to get out of the house and some people who want to work from home. And we've been able to piecemeal that for everyone's comfort level, even though I realize that that's not always going to be the case for us. And we might have to make some difficult decisions. But so far we've kind of asked for volunteers and people who are willing to do that. Now, some other duties for program staff. They've been doing a great job with our people who have not done social media before, started doing social media. People who weren't into education in the past and didn't have the opportunity started helping with the prevention education department. We also quickly realized all of our educational programs in the schools were canceled for the rest of the year, as well as our community education programs were canceled for the year. So we quickly put into place online trainings, and our education department did 13 trainings and over 900 professionals, education professionals, in about a week and 2 days. And that is more than we would have done if schools and communities were open. So I think that they really had the thought that we are going to make lemonade from lemons, and really have done a really good job with that. We also have a few people who had never written grants before, started writing grants. So they really were, I think, appreciative to be able to see kind of how things happen from other places, from other departments. So our current operations, as we speak today, we are actually doing our final test of our teleforensic interviewing. So you can see in these pictures below, we are actually having the child come in and sit in one room, and our interviewer is actually going to be in another room, and they will talk through Zoom. It will be recorded through Zoom. It will also be recorded by our cameras. We use Signalscape, and so they'll see the entire room. So we will actually have 3 recordings that we will be giving over to law enforcement and prosecution after the forensic interviewers are done. And so we did a lot of testing. We had to do a lot of sales and buy-in from our team members to make sure that we had this available so that we could be able to do more interviews in a safe manner. We obviously will have the gloves and the face masks in place. We also have our family advocates are going to be meeting with clients beforehand over the phone or through Zoom with technology, also connecting through emails. And so they will be talking with them before the interview and after the interview through some type of technology. And then we also have used telehealth to be able to provide TFCBT to our clients. I would say by far, our majority of clients have been interested and participated. We've had a few who said, I'd rather wait and continue treatment later on. But it's been interesting. Our therapists have gotten an unusual perspective, seeing kids and families in their own environment and in their own home. It has been like an eye-opening experience. So we're thankful that we've been able to do that. I think every household is feeling additional stress during this time. And so it was just a great way that we could support our families pretty quickly.
I think we're about approaching the end of our time. So I think I'm just going to quickly say before opening it up for questions, if there are questions, otherwise, if not, we can keep talking, that I think that like most places, we've seen a tremendous decrease in reports to Childline here, which is very, very troubling. 20 to 30% of calls generally come in across the country from teachers. And certainly with kids not in school right now and not being in contact with teachers, administrators and other people that they normally spend most of their day with, that's a problem. If a child is now locked at home with their abuser, we know that 50% of the time the abuser is a family member. If there's another problem in the house with problematic sexualized behaviors or an adult, we're very, very concerned about these children, as we not only are not seeing as many, but there are many, many fewer reports that are being called in. We are expecting that we're going to get a lot of calls once this is over and everybody's allowed to go back to work, but we're not sure exactly how much that's going to be. We know that there's been a 50% decrease overall to the calls in Pennsylvania to Childline, which is very disturbing. We are starting a program with our State Attorney General's office. He's terrific, and he's been listening when we've been calling, speaking to his office, where they have an online app. It's been used for schools in the past for bullying. So the kids could report bullying at school, or if a friend thought that another friend might have suicidal ideations, that they could call it in. He's now opened it up for kids to be able to use to report child abuse. Kids already know how to use this app through school, so that if somebody is stuck at home with an abuser, they can use it to alert somebody, or maybe more importantly, their friends know, because kids are still in contact with other kids through computers, phones, other technology. A friend can use their computer and their app to call and help a friend. So here's our contact information. We're more than happy always for questions, comments, or anything else we could do. Are there questions in the chat box? I haven't seen them. I haven't been looking at the chat box is what I'm saying.
I'm going to hand over. Thank you very much, both of you, Abbie and Leslie. That was really actually very fascinating. It's kind of the inner works. Abbie, I must say that the thing about the gloves and the mask was the most depressing thing I've ever heard.
Sorry.
Like we're all gonna die basically. Everybody's here because we're all using it wrong.
No, they just have to be used properly, and nobody's putting that information out. If they're used properly, I'm really a fan. I use them good. Just use them.
That's the problem. That's the problem. We invite a nurse.
Yeah.
To get this
Right.
Okay. I asked one question. I'm going to hand over the questions to our fantastic GRA, Christina Filipakos, sorry, Christina, I think that's the way you say it, who is going to field the questions for us. Christina, are you there?
Hi, can you hear me?
Yep.
Yeah.
Hi.
Thank you both so much for that lecture. There was a lot of really great information in there. I know a lot of people have had questions about how things work on Zoom and everything, and I thought that you guys brought up a lot of good points. So the first question we have is, are there privacy and or confidentiality issues with recording on Zoom?
Absolutely. Yes. I can't tell you how much time, and I'm sure those of you who work for a child advocacy center or actually any mental health has put in a ton of time researching confidentiality and privacy issues. The answer is yes, obviously. There are privacy and confidential issues. Now, I think this is really a risk-benefit analysis, and we've actually had to do a lot of research. So people, obviously there's different types, right? So we have now Google Hangout, we have Microsoft Teams, we have Zoom Basic, we have Zoom Pro, and we have Zoom HIPAA compliant or Zoom Healthcare. And so we also have Doxy that maybe some of you guys have heard of and is also HIPAA compliant, that a lot of mental health providers, there's pros and cons to all of them. And none of them are 100% secure. I'm going to be completely honest with you. And so what we decided to do was we did decide to use Zoom. After looking at Doxy had a lot of dropped calls when we were doing a lot of testing. And so we kind of weighed pros and cons and thought Doxy is HIPAA compliant, but so is Zoom Healthcare. Which one should we use? And we decided we cannot have a dropped call during our forensic interview. We need that to continue going. We also had our county detectives who have a lot of expertise in internet crimes and computers. We went through it all with them, the pros and cons, and we decided as our county to use Zoom. But I know that this is debated across the field and there is no perfect solution, but that is what we decided. But yes, is there concerns? Yeah, absolutely. Luckily, Zoom, as well as everywhere else, has done a lot to improve their security. So obviously we have passwords we're using for our forensic interviews. We are actually also going to use the waiting room as well for that. Yep, so we can kind of see who we're letting in and giving them permission. We actually are gonna have our team members in the background, so the child won't see the team members. Of course, like always, we will tell them that they're there and watching, but the child will actually only see one screen, which is the forensic interviewer. The forensic interviewer will only see the child, but our team members in the background can see both the interviewer and the child.
Thank you.
Awesome, thank you for that. So the next question is, what arrangement did you eventually come up with for employees who wanted to work at the office when they had some risk factors? Informed consent agreement?
So you mean, Christina, if somebody wanted to work in the office now? We actually do not allow them to work in the office. They are all actually working remotely. They can get permission to work in the office, and that is really like our finance person. We're going through our audit and a workers' comp audit right now. And so she does have permission to go into the office to do that filing, but she also has to use she has to use a mask, she has to use gloves, she has to disinfect everything that she touches, as well as we have a cleaning company coming every night.
And what about those that are at risk, Leslie? You talked a little bit about a couple of employees that we thought had some higher risk factors. Did we allow them to come in?
Oh, so that's a good question. So we do have some employees that we consider high risk, or I should say a few of us worry or consider them high risk, but don't consider themselves high risk. So I think when we get to that point, yeah, we would have to do some type of informed consent that they would be making that decision for themselves. Yes, we can't do everything for them, and we probably can't make those decisions for them, but we want them to know about the risk factors and make that decision.
Thank you. I don't see any more questions right now, but I'm just gonna leave some space in case anybody wants to ask any more.
Christina, can you read what Carrie Little from the Child Advocacy Center in Oklahoma just wrote? I think it's very important and
absolutely. So Carrie Little said, I'm Carrie Little with Children's Advocacy Centers of Oklahoma, and we have developed flyers for distribution to essential workers, educators, and adults about reporting child abuse in this time. We have shared that on Facebook and in local OKC and Tulsa media. I'm happy to share those with you all. And then she has put in her email for contact information if anybody would like to contact her.
Carrie, that's great. We would love it. We did a similar thing where our reports were down, just like Abbie said, 50% in Pennsylvania. Our child protective services, meaning suspected abuse, was down 64%. And so we were concerned about those numbers. 80% of all of our calls in Pennsylvania come from mandated reporters, and kids are not seeing mandated reporters right now. And so we were really worried about that. So we did two messaging. We asked mandated reporters who are required to remind them that they're still a mandated reporter to check on kids and remind them about Childline. We also then, just like Abbie said, wanted to talk to kids and parents directly and say, you can report abuse if you feel like a child is unsafe. And for any reason, you can use Safe to Say, which is like an easy, text app, website form, phone number. They also can call Childline. And we did try to share that out through social media as well. It's funny you should talk about the essential workers, because we actually tried to partner with grocery stores employees and saying that, can you guys help us identify if there's any child or safety concerns, or could we advertise in grocery stores? We did get a pushback from the grocery stores and their lobbyists, because they kind of, and rightly so, they're in crisis right now, and I understand that. And these people are putting their lives at risk, serving the public every day. But we had that same thought. So we're definitely interested, Carrie, in any other ideas you might have about getting that word out to essential workers.
Awesome. We have one more question. Is anyone contacting the local news stations to get the info out through television too?
Funny you should ask. I saw that Michelle McDyer from our office, first of all, sent around an op-ed thanking us that we've submitted to several newspapers in this area and in different parts of Pennsylvania. But tomorrow morning, Israel, you'll be wide awake. It won't be a problem for you, but local time at 5:45 a.m., I'm actually being interviewed on one of our local Fox 29 television stations. I was also on one of our local news radio station that, I'm sure every place has one, the local news and the weather and then the traffic. I was interviewed on that radio station last week, and it played this past week and this weekend. So we've been trying, and it seems like there has been some interest in the story. People are interested, they want to know, they want to hear what's going on. So I would say that people in your area, if you haven't done that, I think it's a great idea. There's definitely interest there.
And I don't know, I'm not sure exactly where Robin Grove is from, but it looks like Robin also has done interviews with media outlets to get the word about their concerns for children and how they report. She's from Frederick, Maryland. So she is the other Montgomery County, I believe, Montgomery County, Maryland.
And you're right there with us, right in the middle of, we're not coming out until next spring. So there you are.
You're supposed to be inspiring hope, Abbie.
Hope that we will all get out eventually. We'll get there.
Okay, we have 4 last minutes. Does anyone want to ask more questions or? say something, some thoughts. By the way, excellent presentation. Thank you. Thank you.
You're welcome. I mean, my final thoughts, Gal, would be, I really do think it is bringing all of us to a different place where we are figuring out how to do things differently and kind of having our creative juices flowing. I also think we have to be really compassionate with each other and understanding with each other. I saw there's this great, I've done lots of these, like how to help your staff, how to, you know, reduce vicarious trauma in this time. And it's like start yoga, knit, do deep breathing and meditation. Well, all of those are great things. A lot of us have so much responsibility right now. We can't imagine adding something else to our load like yoga or deep breathing or meditation. But we have on our website and our Facebook today kind of just an easy checklist, like check in with someone outside of your home. You know, do something to get your heart rate up. Just doing something easy and simple. And so it's a great checklist. You should check it out. I do think I'm so glad to work with all of you in this field. And I think that we are absolutely going to get through this together.
I agree. And I think good things will come out of it. And frankly, really good new practices and ways that we're learning that we never would have thought of before. So I really do think, I mean, look at this, look at the Zoom conference that never would have been here before. And Haruv from the couch. What a great idea. Terrific. All right.
Okay, I'm Lucid. On the chat, we have Michelle McDyer writing many, many resources and many ways to be in touch and to hear about your work. Michelle's been working very hard. So there's a lot of information on Facebook and Instagram and everywhere else on Mission Kids that everybody can look at, whoever wants to save the chat. We are now going to hear from Christina about CEUs, and I'm going to say goodbye and very many thanks to Abbie and to Leslie for taking time and preparing and sharing what you've been doing right from the front lines. It's been very lovely, and thank you.
Thank you for inviting us, and thank you for having us. We really appreciate it.
Thank you so much.
Good luck to everybody. We'll all get through this. We will. It's all good. We'll all be good.
Okay,
Bye-bye.
Bye.
Bye.